patients with Parkinson's disease, multiple system atrophy, dimensional Lewy bodies. We also have healthy controls. So what we did here is we digitized the entire scan. So everything here is subjected to a high-resolution confocal scanner. Now what we can do from there is actually launch artificial intelligence detection of proteins in a digitized image, so we can detect what is a tissue, what is the substructure within there, and then we can actually look at the protein within these axons. And so we can see that here in a heat map. This is overlaying this image. So what we can do is actually see topographically how much synuclein is there and what quantities, specifically those deposits. What we see is the deposition of alpha-synuclein in each biopsy site across the region, and then actually look at the subcategories of synuclein across different neurofiber subtypes. So there are different amounts of synuclein in these different diseases. DLB has the most. MSA is sort of intermediate, and Parkinson's has the least. So if we look, there's a proximal to distal gradient of synuclein in Parkinson's disease. Similar in DLB, but it's much, much more. MSA is almost the reverse. There's more distal than proximal. And then the pie chart here is indicating what neurofiber subtypes the deposition is in. So in dimensional Lewy bodies, this big blue section here indicates neurovascular involvement, so specifically neurofibers around blood vessels. In MSA, we see this sort of purple color, and that's indicating subepidermal plexus involvement, a specific region of nerves right below the epidermal layer, and that strongly correlates with MSA. Whereas Parkinson's disease, we see predominantly neurofiber bundles and then occasional single nerve fibers that are positive. So different distributions, both where and how much, that really separate these disorders. The challenges, of course, is that this is a continuum, right? So we think about prodromal all the way through the late stage of disease. So we anticipate there would be change over time. And so this will be, again, a moving process. But we think probably the distribution of synuclein here and the patterns in the skin together may indicate at a very early stage which type of synucleinopathy we're talking about at a prodromal stage. We do actually have 2 longitudinal NIH studies going on right now with blinded data looking at exactly that question. Lots of stuff still to do, but it's pretty exciting at this stage.